VON SMART Program's Ontario Trillium-funded Healthy Lifestyles Education Project. I'm happy to welcome you to the first segment of a two-part educational webinar series on stroke and exercise being presented through the Ontario Stroke Network. This webinar is one of several collaborative learning events being delivered by the VON SMART program and their partner agencies. The goal of this project is to help educate service providers so they in turn are able to better support their clients with special needs, in this case people living with stroke. Today's presenters are Alda T. and Gwen Brown. Welcome. Alda is the Regional Long-Term Care and Community Coordinator for the Central East Stroke Network. Alda is a physiotherapist with clinical experience across the continuum of stroke care. She holds a Master's of Health Studies from Athabasca University. She has been involved with the Ontario Stroke System for 5 years as a Regional Community and Long-Term Care Coordinator with the Central East Stroke Network. In this role, she collaborates with community partners to enhance the services available to support successful community reintegration for people living with stroke. Gwen graduated as a registered nurse and holds an Honours BA in Psychology from the University of Waterloo, a Bachelor's of Education, University of Ottawa, and a Master's in Integrated Studies through Athabasca University. Gwen has been involved with the Ontario Stroke System for 5 years. Prior to her role as Regional Long-Term Care and Community Coordinator for the Southeastern Ontario Stroke Network, Gwen was employed by the Renfrew County CCAC as Director of Quality, Privacy, and Contract Management, and as Nursing Program Manager. Gwen has participated in several regional and provincial initiatives in stroke best practice care. So let's begin today's session with Alda and Gwen. Ladies?
Thank you, Sheila. So this is Gwen speaking, and I'm going to be doing the first part of this presentation, and then I'll turn it over to my colleague, Alda. So while this webinar is intended for VON SMART Program coordinators and volunteer SMART Program leaders, others that are working with people with stroke in day and other community programs will also find the information both valuable and relevant to their practices. So as Sheila mentioned, note that this webinar is the first of two which focus on stroke, its impairments, and relevant considerations when working with people with stroke in a community-based exercise program. So the overall purpose of this first session is to increase your knowledge and understanding of stroke and how to apply that information when you're working with people who've experienced a stroke who may be attending your community program. So just a bit to put it into perspective and give you some idea of the prevalence of risk. In Canada, someone will experience a stroke about every 10 minutes. That equates to about 50,000 Canadians in a single year. If we look in just Ontario, that would be between 15,000 and 20,000 people experiencing a stroke in a single year. And at any given time, 100,000 Ontarians are living with the effects of stroke. Stroke is also the leading cause of adult disability and the third leading cause of death. What's particularly worrisome is that the number of acute stroke events are expected to increase by about 68% within the next 20 years. In fact, over the past 10 years, strokes in people in their 50s have increased by about 24%, and for those in their 60s by about 13%. And they're predicting that the rates are going to double for those between the ages of 24 and 64 in the next 15 years. And from a purely financial perspective, that costs the system about $3.5 billion every year in Canada. So definitely you can see that there'd be a significant stroke population that may be interested in your community program. So the specific objectives for today's webinar are how the brain works, the stroke types and the mechanism of stroke, stroke risk factors, and the effects of stroke. So next slide. So we want to acknowledge that a great deal of the information contained in this presentation is based on the resource Tips and Tools for Everyday Living. This is a resource that was developed by the Heart and Stroke Foundation of Ontario, the Ontario Stroke Network, and the Ontario Stroke System. And you can see that there's a link at the bottom of the screen where you'd be able to access this resource. It's available not only in hard copy, free, but you can also access it online and run through all the different chapters within the resource. Additionally, there's a DVD that supports it, and there's also some family and patient-specific resources that could be of interest, including Let's Talk About Stroke, which is another resource that is offered free of charge by the Heart and Stroke Foundation, and of course, the best practice recommendations for stroke care. Next slide. So to understand how a stroke affects a person, you really need to know how the normal brain works and how the brain functions are organized. So if you think of the brain like a control center, it's in charge of managing all of our physical, mental, and emotional functions. It's divided into two parts, as illustrated in the slide, and they're called the left and right hemispheres. Each of those hemispheres is divided into regions, and each of those regions will control different functions. The right side will control some of the functions, the left others, and still other functions are controlled by both sides of the brain. So speaking generally, the left hemisphere of the brain will control your movement or motor functions, your feeling or sensory functions on the right side of your body. So the left hemisphere is controlling that right side. It also has control over scientific functions, the understanding of written and spoken languages, your numbering skills, and your reasoning. The right hemisphere controls those motory and sensory functions that are on the left side of the body. It will also control your artistic side, so things like music, art awareness, and insight, as well as perception. So you're being aware of and being able to make sense of your surrounding environment. So obviously, depending on where the stroke occurs, it's going to have a different impact on the functions of the person impacted. Generally speaking, about a quarter of the people who experience a stroke will recover with a minor impairment, and probably about 40% with moderate to severe. Should also mention that best practice recommendations for stroke care do recommend 150 minutes of moderate to vigorous aerobic exercise per week that can be done in bouts of 10 minutes or more. So certainly a person having a stroke is going to benefit greatly from that kind of exercise. Next slide, please. So just a bit more about the brain so that you have an understanding of its impact. So it's full of specialized cells called neurons. In fact, there's probably about 86 billion neurons within the human brain. And to work properly and to survive, these neurons need a constant supply of oxygen and nutrients. And the way that they obtain these oxygen and nutrients is through a complex network of blood vessels that are called arteries. And these arteries carry blood to all parts of the brain. Each of those blood vessels will supply oxygen and nutrients to a specific area of the brain. Next slide. So when someone experiences a stroke, it's essentially a sudden injury to the part of the brain where the blood flow in an artery has been stopped. So the affected area of the brain is essentially deprived of oxygen and nutrients because the pathway that was bringing those oxygen and nutrients to that specific area of the brain has now been interrupted. So that immediately begins to damage the neurons and the functions that they control in that particular area of the brain. If the blood flow isn't restored within minutes, the damaged neurons start to die. And of course, the longer that area goes without blood, the greater the damage. Slide. So just to understand that there are two broad types of stroke, and those are illustrated in this slide here. So it can occur in two ways. The first way is when an artery actually ruptures or breaks, and this is called a hemorrhagic stroke. And it's called hemorrhagic because the stroke is due to bleeding into the brain tissue. And this happens in about 20% of the strokes. The other type of stroke is called an ischemic stroke. And it's due to a clot that's blocking the blood flow. And these type of strokes occur in about 80% of the cases. So the large majority of cases or people you'll be seeing is someone who's experienced an ischemic stroke or one that was caused due to a blockage in the blood flow rather than a bleed. So there's also what you may have heard called a mini stroke or a transient ischemic attack. So transient meaning that it's temporary, and ischemic meaning that there is a blockage and a lack of oxygen and nutrients getting to that area of the brain. So the artery has experienced a temporary blockage. It's temporary and transient, and it's often called a warning stroke. So the symptoms may last only a few minutes to an hour, but they should never be ignored. And those symptoms are also typically the same kind of symptoms that someone may experience when they have a full stroke. anyone who's had a TIA is at a greater risk to have another more damaging stroke. So if we can get these people prompt medical attention, that immediately begins to reduce the potential to have a further stroke. In fact, if someone's experienced a TIA, they're probably about 5 times more likely to have a stroke over the next 2 years than the general population. And what they often find is when somebody does go to the hospital with a significant stroke and they do a scan, they'll find that the person has experienced previous strokes that perhaps they didn't even recognize. And so sometimes these are also called silent strokes that people experience before a major event. So FAST is the new way to recognize stroke rapidly. You'll probably have seen some advertisements already on the TV and in other forms of media that are educating the public about these signs of stroke. So what's really important to remember is that stroke very quickly damages and kills neurons in the brain. And once those neurons have been killed, you're not going to be able to bring them back. So it's really important to recognize those signs very early and to act very quickly. Without fast treatment, the chance of reducing that stroke damage decreases very, very quickly. So stroke is a medical emergency. What you want to do immediately is call 911 or your local emergency number. Always, always, always call 911. And the reason for this is that the EMS, the emergency medical personnel who respond to the call, will be able to evaluate where the person should be taken. And the reason for this is that stroke can be treated, but not at every hospital. Some hospitals have been designated to give a special drug called TPA. So when the paramedics respond to a 911 call, they'll be able to do that evaluation and ensure the person goes directly to the hospital where, if they're eligible, they can receive this stroke. The medication that they use to administer this clot-busting drug can only be administered within a certain time frame. So again, it's very important to act very quickly and get them to the hospital as soon as possible. Another good thing to do is when you recognize a sudden onset of symptoms is to note when you last saw the person normal. Because again, this is going to help determine that time frame when they can receive this clot-busting drug. If you remember that every minute delay in treatment, you can lose up to 2 million brain cells. You can see the significance of acting very, very quickly. So these new signs of stroke, the face, so is it drooping to one side? Arms, is the person able to raise both arms? Are they having difficulties with their speech? Is it slurred or jumbled, or they're having difficulty understanding? If you're recognizing any of these, you have to call 911 right away. And as it says, if you must act fast, because the quicker you act, the more of the person you save. Now, they may have some other signs and symptoms such as severe headache or double vision, blurring vision. Anytime you have any concerns of that nature, the best response is to call 911. So just briefly, we'll talk about the risk factors for stroke. Broadly speaking, there's 2 risk factors of stroke. Ones that are called modifiable, or risk factors that can be controlled by lifestyle changes, medical treatment, medications, etc. For instance, an irregular heartbeat can be treated with the pacemaker or medications, and diabetes can be controlled with medications. There are, however, also non-modifiable risk factors, things that can't be changed, such as your age or your gender. So when we look at the stroke risk factors that you can do something about, you can see it's a fairly significant list, which is a good thing because these are the things that you can act on. Just note, too, that the ones that are highlighted in red are the ones that can be directly impacted by participation in an exercise program. So you can certainly see how this can be of great value to someone who's experienced a stroke or a TIA. So high blood pressure is actually the #1 cause of stroke. So managing that part of your health can certainly significantly reduce your stroke. You probably want the blood pressure somewhere around 140/90, but it's going to vary depending on your age and also if you have any other comorbid conditions. High cholesterol and diabetes are also significant indicators for stroke and for other vascular diseases. Being overweight or obese, or even having a significant waist circumference. So sometimes you may have a physician who actually measures around the waist, because this has also been considered to be a risk factor for stroke. Physical inactivity, and certainly offering adapted programs to people who have experienced a stroke assists with this. Stress is recognized as being a risk factor, as is depression. Another risk factor related to diet is sodium intake. So you want to make sure that you're managing your sodium intake, probably below 2,300 per day. Excessive alcohol consumption. So the recommendations currently are about 2 drinks a day for a woman and about 3 a day for a man. Smoking, including secondhand smoke, sleep apnea, and the irregular heartbeat, which was mentioned earlier, the atrial fibrillation. So again, remember that if you have a stroke or you have a TIA, you've increased automatically your risk of another stroke. The risk is greatest immediately after the stroke or TIA and will stay high for probably around 5 years. And overall, maybe about 30% of stroke survivors will have a second stroke. So if you can start to address these risk factors that you can change right away, that level of risk is going to decrease. So even if you're able to work on 1 or maybe 2 of those risk factors, immediately you're bringing down the percentages. And so as mentioned, there's also some stroke risk factors that you can't control. Your age. Now, while strokes can occur at any age, including babies and also in utero, most do occur over age 65. But remember that first slide where we talked about they're looking at younger trends as well. Gender, so women have a lower risk before menopause than men, but then more women than men will die of stroke. Ethnicity, so there's an increased risk for persons of Aboriginal, African, or South Asian descent because of the higher rates of high blood pressure and diabetes within those populations. And as well, a family history. So if you've had a parent or a sibling who's had a stroke before the age of 65, that also raises your risk for experiencing stroke. So that gives you a little bit of background on stroke and some of the risk factors and the different kinds of stroke and what exactly having a stroke will mean. So at this point, I'm going to turn it over to my colleague, Alda, who's going to provide you with some further information on stroke impacts.
Great. Thanks, Gwen. So as Gwen mentioned, in the next several slides, we're going to review some of the most common or more common effects of stroke, and then we'll discuss some strategies that you can use as program instructors that will enable the individual to participate fully within your class. So as we mentioned, there are several various effects of stroke. However, the effects of a stroke can depend on many things. So it'll depend on the region of the brain that was affected, the size of the area that was damaged, and the functions that this area controlled. So while there may be several people in your class who have a stroke, they will each present very differently. The degree to which their stroke affects their ability to move, think, see, and communicate, or experience emotions, for example, will be unique to that individual. So this slide just lists some of the more common impairments associated with stroke. We can have paralysis or weakness on one side of the body. There can be vision problems and communication problems, fatigue or incontinence. Some people experience perception and sensation changes. There may be personality changes and emotional changes, as well as depression and difficulty with memory and attention. So it's important to realize that while some of these effects are easily recognizable, so such as the paralysis or weakness that people often experience, there are others that are sometimes more invisible or more difficult to notice by others. So these would be things such as perception and sensation. And while an individual who has perhaps perceptual or sensation changes, while these effects may seem invisible to others, that doesn't mean that their impact on that person's ability to function isn't just as significant as some of the more visible effects, such as paralysis. So let's just review some of these common effects in a little bit more detail in the next several slides. So first of all, we have paralysis or weakness. This is one of the more common disabilities resulting from stroke. The paralysis or weakness tends to affect one side of the body. It can affect the face, the arm, the leg, or it may only affect one body part on that side. If you think back to the image Gwen showed at the beginning of the presentation that illustrated how the brain is organized, the right side of the brain controls the left side of the body and vice versa. So if someone has a left-sided paralysis or weakness, that means that their stroke occurred on the right side of their brain. So we call paralysis that affects one side of the body hemiplegia, and weakness that affects one side of the body is known as hemiparesis. And so when someone has a one-sided weakness or hemiparesis, they are able to move their affected side, but their strength has been affected. Hemiplegia or hemiparesis can affect a person's ability to perform many functional everyday tasks, such as walking, dressing, and eating. They may need to use effective devices to help them perform many of their everyday activities more independently. So in your program, you may see a person use mobility aids such as a cane or a walker, or other devices such as an AFO or ankle orthosis, or more commonly known as an ankle brace, to make it easier and safer for them to move about. A stroke can also affect a person's vision. It may cause blurriness, double vision, or visual field loss. They may have a blind spot. They may have partial or total vision loss. This can affect one or both eyes, and the vision impairment can be temporary or long-term. For some people, the vision problems can make them feel dizzy, and they may feel off balance as a result. If there is someone in your class who does have a stroke-related visual impairment, then they've likely been taught strategies to deal with their specific vision problem. Some people may need visual cues, such as signage, or use reference points, such as bright tape along the edge of a table. They may use an eye patch or prism glasses, or they may have been instructed to scan their environment by turning their head and using the remaining visual field to look at the whole room. It's best to ask the individual what strategies work for them, and then encourage them to use those recommended strategies throughout the class. A stroke can also affect a person's ability to communicate. A person may have dysarthria, which is difficulty making the sounds of speech clearly. So their words may sound slurred, or their voice may be soft, or can be difficult to understand. But it's really important to understand that people with dysarthria have not lost language. They can still understand spoken language. They still have the ability to reason. They can read, write, think, plan, and decide for themselves. Sometimes people experience impairments in cognition that may affect their communication skills. So in this case, a person with stroke may have difficulty remembering what was said. They may lose track of what they are saying, have trouble sequencing their thoughts, lose concentration during a conversation, become distracted by other stimuli, which makes it difficult to pay attention to the conversation. This is known as a cognitive communication impairment. Or they may have aphasia, which is difficulty using and or understanding language. So in this slide, we'll just speak a little bit more specifically related to aphasia. So aphasia is the loss of language or being unable to use language. It may affect a survivor's ability to talk, read, write, or understand language. So a person with aphasia may have difficulty getting the messages in through listening or reading. They may not understand what is being said, or they may have trouble following a conversation, and we call this receptive aphasia. Or they may have difficulty getting the message out through talking and writing, or they may have trouble expressing their thoughts or finding the right words, and this is known as expressive aphasia. But it's really important to remember that people with aphasia are capable adults who know more than they can say. They can still think, plan, decide, and reason. They can produce some clear words, They're able to understand facial expressions, gestures, and nonverbal communication. Imagine what it must be like to have one of these communication impairments. It certainly would be very frustrating for the individual. And we hear from people with communication impairments that because of the frustration that they often experience in communicating with others, it often results in them withdrawing from social situations. If you do have an individual with a communication impairment in your class, there are a number of great resources available from the Aphasia Institute, and these resources, or this link, is going to be listed at the end of the presentation for your reference. Another very common condition is post-stroke fatigue. This type of fatigue can be experienced by stroke survivors at any point during the recovery process. This fatigue is very real and it's genuine. But unfortunately, post-stroke fatigue is often under-recognized. Post-stroke fatigue is thought to be related to the energy required by the healing brain and the relearning of daily tasks. A person with post-stroke fatigue may feel like they lack energy or strength. They feel constantly weary or tired. This type of fatigue doesn't always improve with rest, and it's not necessarily related to recent activity. It's different than the usual tiredness that people may feel. Can you imagine what it must feel like to experience fatigue to this extent? Many people experience frustration, sadness, and anger when dealing with post-stroke fatigue. So it's important to realize that participants in your class may be experiencing this type of fatigue, and this may affect their ability to perform from day to day within the class. Another impairment related to stroke may be loss of bladder control or incontinence. Some people lose the ability to identify and respond to the need to urinate. They may have urge incontinence, where they feel a strong urge to urinate and lose control before reaching the toilet. This incontinence may be temporary or permanent. So from a practical perspective, it's important that accessible washrooms are available and to provide reminders during classes and during breaks to use the facilities. So back at the beginning of this section, we talked about how impairments related to stroke can be very visible, or sometimes they can be invisible. And in that context, we mentioned perception. So we'll review perception here. And again, just think about how these perceptual impairments can affect an individual's ability to participate in your class. So perception refers to the way we understand our environment. It's how we process and interpret information from our senses, which is vision, hearing, touch, taste, and smell. So some people after stroke may not be as aware of their body or the environment on their affected side. And this is often referred to as neglect. So they may not be aware that their affected arm is hanging off the armrest of the chair, or they may bump into objects that are on their affected side. Spatial relations can also be affected. This may cause a person to misjudge where the chair is when sitting down, or they may misjudge the height of a step. A person may have difficulty initiating movement. So for example, they may have trouble starting to walk upon standing up from a chair, or they may have difficulty using common objects such as a TheraBand. In this case, it's helpful to give short, simple instructions or to break the task into short steps. Sometimes a person may get stuck on a word, phrase, or action and have difficulty moving on to the next topic or task. Providing clear, step-by-step instructions will also help in this situation. Emotional changes are also common after stroke. A person may experience changes in their ability to control their emotions. They may experience decreased emotional control and feel as if they're on an emotional roller coaster. They may be angry one minute and sad the next, or their emotions may not match the situation that they find themselves in. So for example, they may laugh or cry for no apparent reason. Some people experience anger and aggression and feel lots of angry outbursts A person may be discouraged by the physical and emotional challenges that they face. They can lose confidence, develop low self-esteem, and may feel helpless with the little control that they have over their lives. These feelings can cause an individual to stop doing things that used to be important to them, and they may isolate themselves and avoid social situations, families, and friends. Personality can also be affected by a stroke. As a result, a person may say or do things that are out of character for them. They may have difficulty doing the right thing in a situation, or a shy person may suddenly want to be more the center of attention, which wasn't their norm prior to having their stroke. Some people experience post-stroke depression. It's normal to feel sadness and a sense of loss after a stroke, but sometimes this can develop into a true clinical depression. About 1/3 to 1/2 of stroke survivors suffer from depression during the year after a stroke, and most often it develops within 3 months. Depression can occur up to 2 years after a stroke. So the person may experience problems making decisions, confusion, feeling like they're living in a fog. They may feel sad, anxious, guilty, irritable, hopeless, or worthless. They may report a loss of interest in things that once gave them pleasure. They may withdraw from others, report always feeling tired, and also experience memory and concentration problems. We know that less than half of people with post-stroke depression are identified. So it's important for you as instructors to understand the relevance and importance of post-stroke depression and to identify individuals in your class who may be experiencing these feelings or may be expressing these feelings to you and encourage them to follow up with their doctor so they can be properly assessed and treated. And the final impairment that we will review is cognition changes, or specifically related to thinking and understanding. So this is similar to perceptual impairments in that cognitive problems following stroke are often invisible barriers. However, as mentioned, these invisible barriers can have a major impact on their person's ability to function and their level of independence. A person may experience difficulty with concentration. They may be easily distracted and have difficulty focusing on a task. Memory problems can affect the stroke survivor's ability to learn new information and carry it over to everyday tasks. They may have decreased insight into their abilities and limitations. A lack of insight may lead them to perform unsafe actions. And this is where it's important within a class to ensure that there's appropriate level of supervision. When judgment is affected, the person may not make choices that are safe. Problems with insight and judgment after stroke often lead to impulsivity, and a person may act quickly without thinking things through. So encourage individuals to slow down, give clear and specific instructions, divide tasks into small steps, and make the environment as safe as possible. Sometimes people have difficulty sequencing a task. As a result, the person may do things in the wrong order. So again, in this situation, give clear step-by-step instructions to help the survivor perform the task more correctly and safely. So that concludes the formal part of our presentation. We just reviewed many of the common impacts of stroke, and we would like for you now to take a few minutes to reflect on what this means for you. Think about how we discussed how every stroke can be different. A person may experience a few of these impairments that we just reviewed, or they may experience several of them. The degree to which these impairments affects an individual's ability to function also varies. Some impairments can be very visible to us, and some may be less visible. Gwen also talked about stroke risk factors and the importance of being able to recognize the signs of a stroke. So as you reflect there in the next few moments, think about these next few questions. Are you at risk for stroke? Would you be able to recognize the signs of a stroke? And what would you do if someone in your class was experiencing these signs? We trust that the information we've presented has been helpful and valuable to you and will enable you to work more effectively with people with stroke within your classes. As mentioned, we've got a number of resources listed here that have been included in this presentation, and specifically there with the first one is the Aphasia Institute, which I mentioned in discussing communication impairments. Thanks so much for taking time out of your day to spend with Gwen and I. If you have any questions or would like further information, please feel free to contact us.